Hey, what's up, guys? It's Storm, and today is August the 11th, which means officially today I am 1 month on testosterone, which is. I didn't think I'd ever get this far, let's be real. But here I am. I started my transition late 2015, like November, and it's almost 2 years since then. That's pretty big for me, I guess. Uh, I wanted to talk today about my process on tea, some changes, and answer some questions that I think people may have. So, first, let's talk about the process of giving myself my injection. I've already done my injection for this week because I do it bi-weekly. But I can show you what I use for my injections. So obviously I do take it by injection. That's not the only way to take it. You can take it through, I think there's like a gel that you put on your skin, and like maybe implants. I'm not entirely sure about the other options. All I know is that I was not going to do anything that wasn't injection because I was afraid I would not be able to remember. So my prescription comes in like one of those prescription bags. I go to my pharmacy, they come in the bags. Yeah. But inside the bags, for my first one, I got them inside of plastic bags with like a little label on them. For my second one, I got it with the label attached to the box of testosterone itself. I'm going to pull out my box for my first testosterone. It was this. The camera is going to flip it, so it's just going to say testosterone. I can't pronounce anything else. Injection, 200 mg/ml, intramuscular use only. That's important because it's an intramuscular shot, so it's a big shot. Goes into your muscle, and so the needle has to be pretty big. The bottle is about that big. It's a really small bottle. It looks about the same size as my dad's insulin bottles because he's a diabetic. I'm not gonna show you too much, just the bottle. The liquid is clear. And they say to only use it for 1 to 2 shots, at least mine, just because of the risk of bacterial growth. Even though it's pretty much sterile, they don't want to risk anything, because it'd suck if I died of an infection. And then they also give me syringes, which they give me 3 ml syringes, which makes it difficult to measure out my dose because I only take 1/8 of an ml. They come in packages like this, sealed, they're sterile, and they come with this needle on top. This needle is not the needle I use to draw out the testosterone. I use a different needle, which they also give me, to bring out the testosterone. I could also use that needle to inject myself, but it's a thicker needle, and so it would hurt more. And so these are the needles. They're very much thicker than the other needles on top of the syringe already. So what I'll have to do is I'll take this one off, put this one on, draw out the solution, switch them again so that this one's back on it, and then stab myself and inject my testosterone. I probably should have made a warning in the beginning of the video about needles, but it's not like you're seeing any go into any skin. They're still capped, they're in the package, but it's a good thing to warn because some people have triggers that they're kind of rational, but triggers are triggers. So that's what I use materials wise. I also use alcohol swabs or cotton swab with alcohol on it to rub off the top of the bottle and on my thigh, which is where I inject. I inject in the top of my thigh, in the middle of it. So yeah, and the injection isn't bad. I know a lot of people are afraid of needles, and they are long needles, I will say, but they don't hurt. And I knew I was afraid of doing my first shot myself because I didn't want to do it wrong. I didn't want to cause any complications with a needle going into my skin. But luckily, my mother is a trained medical professional, so she helped me with knowing exactly how to do it and not mess up, because you have to like put air into the syringe before you can get the medicine out. So pressure stuff. It's science and it makes sense. But yeah, and there's been some changes. Currently, I'm lowering my voice on impulse. It might be a little bit lower than my 1 week on T video. I'm not sure, because if I talk normally, it's up here, but like I'm training my voice to go lower. So I'm trying to sound more like this than up here, because up here is more feminine, and I don't like it. So it's down here. And a vocal exercise my grandpa taught me this past week, which I need to keep up with, is you go slowly lower as you say this, and it's 3 blind mice. And you try to keep going lower to your lowest note and try to go lower than that. And he taught me this because he was a radio show host or something, and he had to do it because his voice was really high up, and whenever he answered the phone, they always thought it was his sister. So, there's that. He is a cis man, though, and he does have a deep voice now, so it apparently works. So changes I've noticed on testosterone, or other people have noticed and pointed out to me. The first one that I was told was that I seemed more confident, which I can vouch for. I do feel more confident, and I'm pretty sure I'm holding myself in a more confident manner, just because I know that changes are going to be happening, and that some changes have happened, even though they're not very prevalent. And so that really is a big confidence boost. I have had a lot of emotional changes too. Before starting testosterone, I was in a really depressed place, and it's not completely gone, because depression isn't just something that magically goes away as soon as you get T, but I know a lot of my depression was based in my dysphoria, and all of that depression is slowly going away. The more I get called a he by total strangers, and the more I am being told, oh, this thing about you has changed and you're more masculine in this way, I feel like less of that is there. Which, I know my mother's gonna be like, you shouldn't care about how other people see you anyways, but it's a thing. And the only other times I really get very depressed is when it's anxiety based, and that anxiety based stuff is more along the lines of social stuff, and that's totally different, and I'm working on it. Other changes I've noticed on T that are more prevalent, I guess, or my sister noticed this one actually. I'm starting to grow thicker peach fuzz, because I still don't consider it a mustache, because it's it still looks like something a girl could have, but it's peach fuzz, and you can't really see it. You can't see it at all, actually, but I have thicker hair right on the corners of my lips, so I have to shave that because it looks really bad. Another thing I've noticed personally is that my acne has gotten worse. You can see I have acne on my face currently. This one's the most visible, but I have some zits on my forehead. You can see the bumps, sort of, and I have a lot more oiliness in my nose and cheek area. So washing my face is something that I really need to get on top of. I think my sweat smells different, which is weird to notice, but it still smells bad. It's just a different smell. I don't know. It's different, and it's weird. I haven't had much body hair changes, because no, not yet, at least. I have noticed, and if you don't want to hear about genitalia or any of that stuff, mom or family members, please skip over this section. Uh, if you want, like, just skip. I'll probably put I'll like warn when it's over. Yeah. So, starting now, skip. Uh, I've noticed in my lower region, my genital region, there has been changes. Um, the female version of, you know what, I'll just say it, the clitoris. Ooh, scary. It has, it grew. And I know this isn't just me thinking that, because I've been talking to another trans friend, and he also said that the same thing happened. It grew. It's about 3 times the size pre-T, which is, it's big. I was a little shocked because I didn't think it would happen that fast. I thought that it was certainly something that happened after like months and months and months, but it happened within the first few weeks actually, which was very weird to me. I don't know. I was a little bit scared. Yeah. So that, also my libido. If you don't know, it's your sexual drive. That's sadly gone up. Oh shit. Okay, it's sadly gone up. But that's all I'm gonna say on that matter. With my chest. Okay, we're done talking about genitals. Fun fact. Done talking about genitals. My chest, though, we'll move on to that. I feel like has decreased in size because of fat redistribution, which I've noticed a lot of fat redistribution. Like it's been happening just slowly. So like my chest is now shrunk. It's kind of easier to bind, but I still have to bind. I'm binding right now. My trusty dusty binder. And so it's easier to bind. It's just you still have to. It's not like it's gonna go away completely at all. Another way to work on that I know is to work out and like build up pectoral muscle, and stuff like that. You can watch Ty Turner, his videos. He sometimes he talks about how like he worked out and basically just doesn't bind anymore, but he hasn't had top surgery. He doesn't feel the need to. He's a good YouTuber to watch. But yeah, I know that's another thing. And my fat redistribution, a lot of the fat that was on, like, my thighs feel thinner for some reason, even though I've always had really thick thighs. Like, that's a thing that's always been on my body, but I feel like they've shrunk a little bit. Only a little bit, not really noticeably, just to myself. Also, a lot of my fat has moved towards my belly, which I don't know if I'm not really happy about that, but that's where most males, like, their fat goes to. Because women, their fat distributes between their thighs and their hips and their bellies. Guys, it tends to just go into the belly. That's why you see guys with, like, those big bellies. So there's that. But I'm not too concerned about it. I also felt like in the first few weeks I lost fat. Not necessarily lost weight, but fat. Because my clothes started fitting looser. Like my pants, they were like loose in the way that they hadn't been before. Because like wearing guy pants, my hips are always crushed in them. And then suddenly they were really loose one day. And I was like, when did this happen? So there's that. That's kind of all the changes I've really noticed on testosterone. That's also my process of how to take it. For me, I would record actually taking it, but I feel that's a little too graphic for the internet yet. Or at least for me, it'd be difficult for me to record it because the angles, and like I don't really have a real camera yet. So, yeah, that's it for today. Vocal range, I can test, kind of. That's what I'll do. I'll test my vocal range. So, we're going to start from all the way up to my highest note talking, which is way up here. And I can go lower and 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 lower. And this is about where it starts to get weird when I talk. Ugh. I've stopped being able to sing some high notes in songs. And my singing isn't the best. I'm not trying to be that person who always sings and they're terrible at it. It's just something I notice when I sing along to songs in the car. So I'll just sing a little clip from like Panic at the Disco's Always. It was always you falling for me, now there's always time calling for me. I'm the light blinking at the end of the road. Blink back to let me know. When I said I'm the light blinking at the end of the road, that's about as high as I can really go. That's a very high-pitched version. I can sing it lower and be fine, but like that's where I started feeling comfortable, and going up it was worse. That's how I used to be able to sing it. And yeah, that's about it. Thanks for watching, and I will keep updated with testosterone changes and possibly like answer some questions about being trans, how to handle a trans family member, stuff like that. So, thanks for watching, and I'll see you guys next time.